The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, everyone. Welcome to the next episode of TMD Demystified. I am Tony Urbanek. Today's title is why the dental industry does not want to debate the science. That might sound a little strange, probably is to you, but I believe this particular podcast is going to be number 247 episodes that I've done on TMD Demystified. And just about every episode I have encouraged my doctor listeners, and I know there are many dentists who listen to this podcast, some continuously, some intermittently, and I also know patients listen to this. But the podcast, this particular podcast, which is done on a Tuesday morning, is always primarily directed to dentists, dental doctors who either want to know more about TMD or want to find out what I have to say about and teach about TMD. Both of them are valid reasons, and I welcome you. I also welcome any patients. But my weekly podcast, this particular podcast, is directed to primarily dentists, and I've just begun a weekly streaming that is recorded on Saturday at high noon Central Time, which is primarily directed to patients, although doctors are available to look at the streaming also. It is also entitled TMD Demystified. The information is there, and my purpose in both the streaming and the weekly recorded podcast is to get this information out to as many dentists and patients who either treat or want to treat TMD, or patients who believe they have the problem that need a solution to the problem, which has not been historically out there for forever. Since the inception and the first diagnosis of what we now call temporomandibular joint disorder, which for 50 years or more and continuously is referred to as TMJ, the public and most doctors are well aware that the perception is there is no solution for TMD. That is the perception. And so this episode, with this kind of strange title, is important because we have to confront this head on. I've encouraged doctors to confront me, to debate the science behind what I have to teach, and after 240 some episodes, I have not had a single doctor question what I have to say, what I have to teach, the science I bring out, the academic studies, the statistics, my opinion on things. None of it has been addressed, questioned, criticized, which surprised me, which absolutely surprised me. The live stream that I did just a few days ago focused on a patient that I have not seen yet, although this patient wants to come to and visit me, see me, do a consultation all the way from, I believe, Idaho. And in preparation for that, she sent me multi-page synopsis of her situation, the symptoms, what she thinks about it, the stresses, but her situation before she got in to see me to give me as much information as possible. And I touched on this. I described it in more detail in the live stream that I did a few days ago, but there was one paragraph here that exemplifies the perception that is out there among dentists. And then the question for me is, why is there such a negative perception about TMD? And more importantly, why have I not generated any particular interest in criticizing, confronting me, debating me, bringing out other points of view on TMD? It is quite amazing to me why that has not been the case, because I know that the different segments of the profession, of the dental profession, and even the medical profession have been interested in what I have to say. We can track it on our podcasts. So, what this particular patient generated in my mind was through a particular paragraph. I'm going to read this paragraph to you, and then I'll have a couple comments on it, and then we're going to go into what I need to do on this episode, and that is to bring out specifically an answer for the viewer and the listener, and for me, myself, why what I have to say, teach, has been totally ignored. We'll talk about that later. Totally ignored. And I'm really surprised. I'm not out to create conflict. That is not my purpose. My purpose is to bring out information that has been scientifically tested in, in the peer-reviewed literature. It isn't not only my study, which is an independent study done through Middle Tennessee State University, showing the statistically significant results on treating over 3,000 patients with a very simple device and protocol that unloads the temporomandibular joint and decreases the inflammation in the joint, which is all this thing does. That's all it does. Decreases inflammation in the joint. And now we've proven that the inflammation in the joint creates directly all the symptoms. That's been discussed on many of these podcasts. I won't go into that again. The issue today is to confront why this information has been totally ignored, and I am going to bring that to your attention today. But this particular patient writes this when she describes what she tried to do about this in Idaho. She has these symptoms. She thinks she has TMJ problems. And she writes, I asked the local dentist who comes into our bakery for lunch. She actually owns a bakery. I asked my local dentist about this. I described it, and he said it might be TMJ. And he said, TMJ is so complicated, he didn't treat people with it because he hadn't been trained on it, which is a true statement. You don't go through dental school and learn anything significant about treatment or even diagnosis of TMD. And she continues, and that there's basically nothing dentists can do for it, except he recommended me to ice it. And then she followed by saying, so I did that, but didn't believe him because I think the creator made it so your body can heal itself. And that statement by this particular patient, whose first name was Rebecca, was profound. Rebecca, you have said a very profound statement, because But I didn't believe him because I think the Creator made it so the body can heal itself. And that is what we call inflammation. That is the body's attempt to heal itself. Sometimes it does it. If you cut yourself and you see a little red line on either side of the margins of the cut, that is inflammation. And then that turns into healing, and then that turns into a scar, and you no longer have that laceration on your finger or your hand or wherever it is. That is the method of inflammation in its most simplified form. But inflammation is involved with each and every disease that I can think of in the human body. It is involved. It is the body's response to damage, any kind of damage, and the body's response to try to heal that damage. That is what inflammation is, and that is why inflammation is so important to be taught in the healing sciences in medical school, dental school. Since I went through both, I got a double dose of what we need to know, should know about inflammation, and in addition, I received a degree in cell biology and gross anatomy, but especially cell biology, after I transited dental school. After I completed dental school, I acquired a degree in cell biology and anatomy. I fully understand how inflammation is so important. We know a lot about inflammation. We know a tremendous amount about inflammation, but there's a tremendous amount about inflammation we don't know. Because if we knew everything about inflammation, we would be able to heal and treat many more of our diseases successfully. I have made the statement before. I firmly believe that when we know everything we need to know and should know about inflammation, how it operates, how it can be ineffective, the problems with inflammation being effective, we will then have the solution to the various types of cancers. But that is my opinion. That is not fact. So when I give an opinion, I always make sure this is my opinion. Fact, though, is the things that I like to talk about. So today, with that as a prelude, and acknowledging this patient as being very profound in her statement about how inflammation actually is the body's response to damage in an attempt to heal, we need to talk about the perception of dentists, why this is so difficult, because that is what they're taught in dental school. They're taught in dental school that TMD is a complicated issue. It's a complicated disease. I've touched on that so many times. The dental schools teach and perceive and promote that it's complicated because it has a complicated name to this joint, complicated characteristic to the joint. Well, temporomandibular joint operates like any other joint in the body. That's the truth. That's the fact. Neurologically, physiologically, histologically, anatomically, the tissues involved operate just like hips, elbows, and knees. It has a different position. It has both a rotation and a translation to it, which is a little unique for a joint, but that doesn't make it different than any other joint in the body in itself. But that is what every dentist is taught. Every dentist. If you are a dentist, I am certain that you were taught that in dental school, and that is not valid. Temporomandibular joint operates like any other joint in the body, and that is how I was able to figure out really how inflammation creates all the symptoms from the starting point that this joint operates like any other joint in the body. But today's topic is why the profession, the dental profession, and individual dental organizations and medical organizations and specific specialties and specific dentists do not want to debate their perception of TMD, whether their perception based on knowledge, their perception based on training, their perception based on experience. They won't debate. They won't confront what I have to offer, and that again has been really surprising. So what did I do to see if I could figure out why I have not been engaged? Because it was a question for me. It's like, Why haven't I been engaged by parts of the profession, individuals in the dental school who profess to know a lot about TMD? They even made a specialty of oral facial pain now. And the doctors who are specialists in oral facial pain profess that they know a lot about it, and they profess that they can fix it. Yet they will not debate a different paradigm that totally changes their understanding of the paradigm. But the problem is no debate, and I am open for debate. So what did I do? I asked AI. We have been given a tool now, and it is, in my experience, is a rather significant tool. It is not perfect. We have not, obviously, the debate goes on AI for sure. There is a debate on AI on how it should be used, can be used, the problems, potential problems with using AI. I am not here to even discuss that part. But anyone who has been using this tool, artificial intelligence, for the past few months must admit that it is extremely valuable in presenting neutral, honest evaluation of information available to AI. It is rather neutral, and it is not biased. It gives whatever information is available and can debate the different parts of a debatable situation. So I give it kudos, and I think it's very valuable. But what did I do? I asked AI this question, which is I already voiced. Why have I not had any engagement from any part of the dental profession? No engagement as to what I teach, profess, and have studied on and have developed out of the current literature, the current peer-reviewed literature, which shows that chronic inflammation creates each and every one of those symptoms, rather than the old paradigm, which is basically the myofascial function, myofascial pain dysfunction syndrome. Myofascial pain dysfunction syndrome, which was first established in 1969. I did a podcast on that. Dr. Danny Laskin, an icon in oral and maxillofacial surgery, a chairman and professor of oral and maxillofacial surgery at Illinois University, and he published, I have an original copy of that, 1969, the myofascial pain dysfunction system theory. And he admitted it was a theory. And that myofascial pain dysfunction theory has been used for the past almost, going on, 69, 55 years, 56 years. It's the old paradigm. So what does AI have to say about this? What does AI say when I ask? AI is very familiar with my work, very familiar with everyone's work in TMD. If you ask it a question regarding any particular study, any particular position, any particular theory, it will give you the data, and it amazingly puts it back in your face within a few seconds. So what did AI bring to my attention when I asked it, how come no engagement? Why am I not stimulating my own profession, my own specialty of oral and maxillofacial surgery, my own profession of dentistry, and my own profession in medicine? Because the medical doctors know they don't know anything about TMD, but when I educate ENT doctors in particular, or neurologists, about how chronic inflammation in the temporomandibular joint can create, for example, Meniere's disease, or be misdiagnosed as ear infections, I also get no engagement. And I've attempted to do that many times, just attempted to get engagement. So I'll just share my screen with you. That's what AI has to say about this. And I'll go through this. We'll see what I have to comment on this, but this is what artificial intelligence tells me the reasons why no engagement. First of all, there is cognitive dissonance. This is directly from one investigator, one author by the name of Leon Fessinger. The bullet points are clinicians have invested decades in their model, the myofascial pain dysfunction syndrome theory model. Your framework, the misdiagnosis of migraines versus TMD, and we know, I'm certain, and any dentist who tries to treat TMD by whatever method knows that he sees constantly patients come in that have been told, been diagnosed, are under treatment, have been medicated for migraine headaches, as they say in the South, my migraines, that those migraines really are temporomandibular joint originating pain. And it originates because the muscles get signals to get tightened. Wherever the muscles of mastication are attached to the bone, it pulls on the areas of the periosteum that elicit pain, and that is what creates the pain itself, the nociceptors in the periosteum. So there's a level of cognitive dissonance, and the ineffective treatment of night guards, meds, physical therapy, cognitive therapy, in other words, trying to talk someone out of not being anxious, talk them out of their bruxism, goes totally against what they already believe. This creates psychological discomfort, and the psychological discomfort ends up with rejecting new information, minimizing claims, and avoiding engagement. And that's what's happened. So there's no way to get through this unless it's going through it, to confront it head on. To sugarcoat this in any other way, it'd not be appropriate scientifically. It would not be appropriate from a liberal arts point of view. It would not be appropriate by trying in an attempt to solve the problem, because my mission is to solve this problem, not only for my own patients, not only here in Middle Tennessee, not only for my own work and myself. My mission is to solve this problem throughout the healing sciences, throughout medicine and dentistry, throughout oral and maxillofacial surgery, of which I am one, and eventually throughout the United States and throughout the world, because I can see, I have been privy to, I have experienced the thousands of patients in my own vicinity, Middle Tennessee, and acknowledge and aware of the millions of primarily women, 90% females, 10% males, who experience these sometimes devastating symptoms that no one seems to have a solution for, exemplified by Rebecca and her statements from her statement about her dentist who comes into her bakery. The second thing that artificial intelligence has to say about this particular issue is the status quo bias, or I guess can be talked, plus the sunk cost fallacy. Physicians and institutions prefer existing workflows, low cognitive and operational friction. So it's basically the easiest way through. They're used to the preferred and existing workflows, and there isn't any extra work or effort that needs to get put into going through those, and so they don't want to confront. Also, and this is the one that I think is really should be addressed, have financial and reputational investment in current approaches. Accepting the model that I promote, that I can prove statistically, anatomically, equals admitting prior inefficiency or error. It's hard to be wrong. It's hard to admit you're wrong. I admit that. I've been wrong a lot. I can tell you all kind of things I've been wrong in my life. I can tell you things that I've done as a surgeon and as a scientist that you try something and it doesn't work. You're wrong. It doesn't work. But a good doctor, a good scientist, a good person, if you want to be healthy and happy, the first thing you need to do is confront when you're wrong, admit it, and go on. Get on with it. But there is such a thing as status quo bias plus the sunk cost of fallacy. And it costs. If you continue to maintain that what you're doing is wrong, it costs you in reputation, it costs you in money, it costs you in time. And then AI finally talks about the professional identity threat. And specialists and gave examples, neurologist, orofacial pain specialist, different dental subsets, which would be oral and maxillofacial surgeons for sure, have identity tied to diagnostic ownership. And so when they diagnose it and they are responsible for treating what is euphemistically called TMJ, but more appropriately called temporomandibular joint disorder. And there is only one disorder, there's not multiple disorders, which goes contradictory to what orofacial pain, quote, specialists maintain and teach. But they use antiquated, archaic concepts in their proof or their theory. But the model that I have shown reassigns causation. We talked about the migraine actually being temporomandibular joint disease, chronic inflammation within the joint, which causes chronic headaches. Everyone who treats TMD or even tries to treat or doesn't even treat it, but has patients who say they do, they all, number one symptom is headache. What's the difference between a bad TMJ headache and a bad migraine headache? Actually, nothing. Nothing. Even the auras, the visual auras, have been shown to be created by pulling the ocular muscles generated from the brainstem in the exact area where the sympathetic nerve system gets stimulated to stimulate the muscles of mastication. They're cranial nerves, all going to the same place in the brainstem. So my information potentially redistributes patient flow and authority. That is a problem. This triggers defensive gatekeeping behavior, not scientific debate. That is the last line of this particular area. AI gave me a lot more information. I mean, it ran on for pages and pages. I selectively selected these 3 points to simplify what AI brought to my attention based on all of the information out there available to AI. And by the way, anyone who would like the entire AI presentation to me, all you have to do is contact me. I'll be happy to send it to you. So I'm not being selective from the point of view. I just want to show you the appropriate stuff. I'll be happy to send you the entire AI presentation. When I ask the question, is a little longer than my statement here, but why is there no engagement to debate this issue? It's like the professions don't want to debate the issue. And I just brought out the three answers, the three primary answers that AI gave me as to why debate is avoided. And I can't think that a thinking person, especially a professional, especially a scientist of sorts, and especially a dental doctor or medical doctor, would want to avoid debate on an issue, on a disease that affects millions of women throughout the United States, and the perception is that nothing can be done about it that's effective. That's what blows my mind. That particular issue blows my mind as to why no debate. And now the specifics of that, based on a lot of studies outside of my domain, that this is not just within dentistry, this is not just within medicine, but it is coned down, in my example, to the lack of debate, lack of engagement about talking about, debating about the issue based on science of TMD versus the old paradigm. There's no doubt that when you address this problem of TMD with a new paradigm, that chronic inflammation creates each and every one of the symptoms, all of the symptoms, both the painful and non-painful symptoms of TMD. Painful being headache, earache, jaw pain, neck pain, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of locking, and the non-painful symptoms being tinnitus, ringing in the ears, subjective hearing loss, which is the fullness feeling in the ear, like your ear's full of water, and vertigo, dizziness. Those three symptoms are well known, well established under the parameters and control of ENT doctors, otolaryngologists. They call it Meniere's disease, and otolaryngologists, ENT doctors admit they have no solution for Meniere's disease, but those three symptoms are the non-painful symptoms associated with TMD, and those three symptoms will decrease and can be eliminated by decreasing the inflammation within the temporomandibular joint by unloading the temporomandibular joint according to a protocol. All right, enough said. If there's anyone out there who would like to confront, who would like to engage, who would like to debate, who would like to comment, who would like to criticize, I can be reached. I can be reached and will respond at Tony@tmjservices.net. And I've said that many times. For those doctors who would like to who have stimulated to think about this, who have been stimulated to know that there is a different paradigm that is actually effective, more can be learned at www.urbanic, URBANEK, Tango Mike Juliet, urbanictmj.com. If you want to learn how we and the other doctors in our dental network throughout the United States and growing, who use the Urbanic device and protocol, which is nothing more than a orthotic, if you will. You can call it I call it a tool. It's a tool to use according to a protocol that unloads the temporomandibular joint effectively long enough that relieves the inflammation within the temporomandibular joint that actually decreases all of the symptoms noted. So I encourage you to engage. I encourage you to think about it. I challenge you to look at the old paradigm and see if it makes any sense at all, which it doesn't. You can treat symptoms to your heart content, but if you actually treat the cause, the common denominator, which is chronic inflammation within the temporomandibular joint. Chronic inflammation is the body's response to healing. But when you have the three primary causes to damage the joint, which are bruxism, acute trauma of various kinds, and functional malocclusion, those are the three methods to damage a temporomandibular joint. Once the joint is damaged and it does not heal itself, you have chronic inflammation and you're off to the races, developing each and every one of those symptoms over a period of time. I look forward to the next episode of TMD Demystified. I challenge my colleagues. I challenge the patients to challenge their dentists. I challenge the patients to challenge their dentist. Ask your dentist to look into this. Ask your dentist to go to www.urbanictmj.com and see if it doesn't make any sense, to see if there's all the information about this is there. All the information is on the other 246 episodes of TMD Demystified, or on the blog that I write once a week, and all those blog articles are on our website. Until next time, I look forward to being with you. I hope I help you think about this. I hope I help the profession. I am Tony Urbanic, and this is TMD Demystified.